In this video, I want to talk to you about your child and celiac disease. If you like the video and the content, please give it a like or subscribe to my channel. This is a great resource for living a gluten-free life. Hi, my name is Mike Hines from justnogluten.com. Celiac disease occurs as a result of a child's genetics and exposure to a trigger. A child who develops celiac disease probably inherits the risk from one or both parents and then develops the disease when exposed to the dietary trigger, which in this case is gluten. Once a child is confirmed as having celiac disease with the proper testing, the only treatment is to completely avoid gluten. I'll say that again. A strict gluten-free diet is the only treatment for celiac disease. Even eating small amounts of gluten can cause intestinal damage, allowing the symptoms to return. Now, following a gluten-free diet is going to require adjustments for both parents and children. Celiac disease is different from a wheat allergy. The difference being, allergies occur when different parts of the immune system are activated by wheat, causing allergic symptoms such as hives and wheezing. Celiac disease, on the other hand, is a condition which transpires in the small intestine. It is basically an autoimmune disorder that occurs to people who are genetically predisposed to this condition. Celiac disease in children is going to be a bit difficult to diagnose, since those affected by this condition are probably too young to talk and communicate properly. Since celiac disease in children can stunt their growth and reduce thriving, it is advisable to be aware of one's family history to be able to tackle this condition. Children are initially introduced to solid food around 5 to 7 months. And it may be around this time that a genetically predisposed child may be exposed to gluten, which in turn triggers the autoimmune disease. Regular intake of food products with gluten can worsen the celiac condition and ruin the small intestines. This condition is also known as celiac spruce disease and is passed on genetically from one relative to another. Celiac disease in children can prove fatal if left untreated or unnoticed. Frequent ingestion of gluten can destroy the villi as well as the mucosa lining of the small intestine. Gluten intolerance is an issue that even adults have trouble coming to terms with. So it's even going to be more difficult for children to accept. Parents are going to have their hands full just making sure that their kids eat what he or she is supposed to and avoid the gluten-based foods. The good thing here is that it is easier to teach good eating habits to children. Adults who have been eating gluten-containing comfort foods for years often face withdrawal symptoms and irritation at having to give up their favorite foods. In most cases, you should not have this problem with children. If you guide them properly when young and explain the importance of eating the right foods, they will grow up with these habits. Your first step will be to get your child diagnosed by a qualified doctor to see if they are gluten sensitive or have celiac disease. Let's have a look at some of the symptoms. There are a few common symptoms that are often displayed by children who are gluten sensitive, and these can be constipation, cramping, a bloated stomach, lethargy, irritability and restlessness, unexplained rashes on the elbows and shoulders area, abnormal stools that are watery or large, delayed growth. Celiac disease in children may not be immediately obvious, since this disease is triggered by the presence of gluten. Gluten is a protein found in wheat that can cause the autoimmune system to affect the absorption function of the small intestine. One surefire symptom of celiac disease in children is stunted growth, and this is caused by the malfunction of the absorption process of nutrients in the small intestines. This symptom manifests itself in the slow weight gain of the affected child, as well as the slow growth, either horizontally or vertically, of the child. In some cases, the child does not have any of the more common symptoms, but instead has problems with slow growth, iron deficiency, anemia, constipation, oily stools that float, gas, skin rash, fatigue or joint pain. Some children may also have behavioral symptoms such as anxiety or sleeping problems. Older children may also be shorter than normal for their age, have difficulty gaining weight, delayed puberty or other problems such as anemia or bone thinning. Let's have a look at some skin symptoms. A skin problem known as dermatitis herpetiformis is common in adults with celiac disease. But this condition is uncommon before puberty in children with celiac disease. A child may have skin symptoms with few or no gastrointestinal symptoms. The symptoms of dermatitis herpetiformis include intensely itchy, raised, fluid-filled blisters on the skin, usually located on the elbows, knees, buttocks, lower back, face, neck, trunk, and occasionally within the mouth. The worst symptoms are the itching and burning, as scratching causes the blister to rupture and dry up, but this leaves an area of darkened skin and scarring. A skin biopsy may be necessary to see if the rash is dermatitis herpetiformis. The condition will clear up after elimination of gluten from the diet, although this may take some time. A child with celiac disease may also suffer with dental problems, commonly develop changes in the permanent adult teeth. This may include changes in the enamel covering of the teeth, causing cream-coloured, yellow or brown discoloration and grooves or pits in the teeth. Children with celiac disease are also at risk for weakened bones, caused in part by poor absorption of vitamin D and calcium. A gluten-free diet will clear the problem. Taking supplements like vitamin D and calcium are also recommended. Alright, let's discuss brain fog. This is one of the most common characteristics of gluten sensitivity. As kids with brain fog may often feel tired or like they just got out of bed. They can be very forgetful and may have trouble focusing or completing tasks. Now we come to headaches and migraines. It's not normal for children to experience chronic headaches or migraines. If your child has experienced these symptoms, you should immediately take him to your doctor. This could be a sign of gluten sensitivity. If your child is gluten intolerant, it is imperative that you immediately start them on a gluten-free diet. Now, most children are not going to understand what gluten sensitivity is, and you will need to approach the subject in a manner that does not make them feel different or inferior. This is where a little bit of psychology comes in. It would greatly help if the parent preparing the food is able to make two different versions of the same food. One gluten version and one gluten-free. And this makes it look as if everybody's eating the same food. Over time, your child will grow to understand that their body doesn't treat gluten in the same way that others do. However, in the transitioning phase, it's best to keep most things constant and yet maintain a gluten-free diet for the gluten-sensitive child. As your child reaches school-going age, it would be a very sensible idea for parents to have a chat with the teachers and the school administrators about the child's gluten intolerance, so that other adults can keep a discreet yet a watchful eye on what the child eats. One great idea is to allow your child to prepare the food at home to take to school. And at the same time, explain the importance of eating gluten-free foods. Let's face it, they're going to face many temptations at school. Friends who may eat candy and chocolates, birthday parties, they might get invited to school camps, etc. The best way around this is to ensure that your child sticks to the rules and educate them properly on the topic. Kids hate to be different, so they might just rebel a little from time to time. However, the old saying applies here: a burned child dreads fire. When your child doesn't feel too good after what he or she ate, they may be more inclined to stick to their gluten-free diet. Ultimately, there is no need to be overly worried. As long as you do your best to cater to your child's needs, they will grow up understanding their situation and will live a gluten-free life. Now, a word of warning here. Now, the usual gluten-free diet often relies on rice, potato and corn to replace the standard gluten-containing breads, pasta and cereals of a wheat-based diet. However, there is a growing concern over the nutritional value of the standard gluten-free diet. Most commercial gluten-free products use processed flours and starches rather than whole grains. These products often use more sugar, fat and salt to make them closer in texture, but much higher in calories compared with their wheat-based counterparts. Now, a gluten-free diet that relies heavily on these commercial products may be less healthy, probably contain more sugar, fat and calories, and may also cause more weight gain compared with a gluten-free diet that includes fewer commercial products. I do hope you found this video both helpful and informative. See you in my next video. And again, thanks for watching. Bye bye for now. See you soon.